Graduated Driving Licensing Programs by Jasmine K. Soloman. Teen fatality rates are 3 to 4 times higher than middle-aged adults. Motor vehicle collisions account for 36% of mortality in teenagers, ages 16 to 19. In response to these consistently high statistics, states around the U.S. have responded by introducing graduated driver's licensing programs, also known as GDL programs. A GDL program is a program that requires teen drivers to obtain a learner's permit with many regulations prior to qualifying for a driver's license. There are many different levels of GDL programs, but commonly, a program is a 3-phase program that limits the hours a teen can drive, limits the number of passengers in a vehicle. Many teen drivers are required to ride with experienced drivers and log their hours prior to getting an unrestricted license. When they finish their required time and hours, they can apply for their driver's test or unrestricted license. GDL programs provide new drivers with experience driving in low-risk conditions before being exposed to higher-risk conditions. Evidence-based studies on graduated driver's licensing program in many states, such as New York and Massachusetts, with strong GDL programs, study and evaluate and analyze vehicle accidents and traffic fatality rates before and after the programs are put into place. The goal is to analyze these groups and the effectiveness of a strong GDL program using data on traffic accidents, injuries, and fatalities within each group. Using data from before and after GDL programs are put into place, the evidence will be evaluated and the sustainability of each program and its effect. Will these programs decrease the number of motor vehicle accidents with fatalities and incapacitation in teens and young drivers? Social and health factors. Social and health variables that can affect driving behaviors in a negative way are health problems, drugs and alcohol, additional teens in vehicles, pressure from peers, television, and video games. Some positive things are positive time with elders driving and driver's education. When studying the effects of graduated driver's licensing programs on teens and accident fatalities, some of these variables listed above are choices that are made by the driver. In the instance of traffic violations and vehicle crashes, there are many physical and health factors that can cause impairment, such as diabetes, high and low sugar, which is not as common in younger people, and other factors that can affect people of all ages, such as seizures, mental disability or disorder, and prescription medications. All these can affect the judgment of the driver. Social factors that can affect young drivers and hinder their driving practices are number of accidents increasing by multiple passengers in the vehicle, significantly increasing when there are teens in the vehicle. There are also movies and video games that make breaking laws, speeding, racing, and unsafe driving practices very appealing, encouraging poor driving decisions. Some teens are also encouraged to drink and drive. In order to incorporate the social and economic factors into the development of a GDL program, all GDL programs should have a 3-phase model for 4-level systems to slowly earn more monitored privileges. Also incorporating the positive social factors that can affect GDL programs, such as safe passengers. A passenger can perform as a co-driver and can help support the new driver by making the driver take a second look at their actions. This is usually a passenger that is older and more experienced as a driver. Programs such as high school driver's education help to educate teens on laws and the importance of wearing seatbelts. These programs also inform new drivers of the risk of substance abuse while driving. Some programs, such as this, educate on safety and warn drivers about possible distractions that can cause accidents. 3-phase programs, such as GDL programs, require drivers to log their hours and earn future privileges, with many restrictions to keep drivers safe until they are ready to be fully licensed drivers. GDL driving programs encourage new drivers to drive safely, following laws, practicing safe driving practices, and earning their license, which also helps earn their future. The GDL program should appeal to all populations and communities to keep the goal in the community to keep everybody on the road safe. A dangerous driver on the road will increase vehicle crashes and fatalities for the population as a whole. Infrastructure. When developing a program, the key players are the most important people involved in creating the program. In implementing graduated driver's licensing programs, there are many key players that work together. Data is collected by many organizations, such as the National Highway Traffic Safety Administration, each state's Department of Commission, and motor vehicle collisions, law enforcement agencies such as Highway Patrol, American Automobile Association, and Centers for Disease Control. The data is collected on specific populations, in this case teens. GDL programs vary state to state, so some of these stakeholders will also vary. Most GDL programs include teens from age 16 to 18 years old. Additional players are adults that assist in driving the teens and driver's education teachers. National data is gathered by the internal stakeholders on a state-by-state basis. Graduated driver's licensing programs are created. Then the program is created and implemented into the population, and it is studied. Once the data is gathered, it is then evaluated to assess if the program is working or there needs to be a change. The Governor's Highway Safety Association website lists all GDL programs along with the research, rules, and regulations for each program. In Massachusetts, the Fatality Analysis Reporting System, the Missouri Census, the Massachusetts Department of Transportation all put together a database to compare data before and after the enactment of GDL programs. In upstate New York, police put together crash reports routinely collected prior to and during this GDL program implementation. The internal stakeholders are directly influenced by the results of each GDL program. The external and secondary stakeholders are not directly a part of the creation of the program, but they are indirectly affected. Some external stakeholders are drivers and teens, parents and families with children, hospitals, emergency medical services, and ambulance providers. This also affects insurance companies. They can be external stakeholders also. It is highly recommended that in all states, driver's licenses be issued to drivers over the age of 18, and anybody under the age of 18 is involved in a GDL program. A strong GDL program will reduce the driver injury rate, the passenger injury rate, and the pedestrian or bicycle injury rate with no impact on licensed driver rates. Implementing a strong GDL program will lower insurance prices. This will decrease the emergency call volume, which will in turn decrease the cost of EMS and fire departments in many areas. The program will minimize risk to citizens and risk to property damage and people in general in a community. There are so many positive benefits to implementing a strict and stringent, strong graduated driver's licensing program in a community. Graduated driver's licensing programs are the most highly looked at graduated program in public health achievements in the 20th century. The implementation of GDL programs will decrease accidents and fatalities related to vehicle accidents in all states. It is obvious that the implementation of these programs reduces fatalities. This is proven by many evidence-based studies performed in all areas all over the U.S. Evidence-based studies show that states with GDL strong programs will experience the most substantial positive change. When implementing new laws and regulations, there are often ethical concerns. Public attitudes about GDL programs are very positive. The decline in serious vehicle crashes and the number of fatalities involving new drivers has shown the public that these programs have a positive impact. When they were first implemented, there was some initial resistance from teen population because of the delay in obtaining a driver's license without any restriction. Also, the restrictions caused employed teens to have difficulty with transportation based on availability of public transportation. This was especially difficult in less populated areas. One controversial issue about implementation of GDL programs is in-vehicle monitoring technologies. GDL programs vary state to state. Some states use methods of implementation of in-vehicle technology and automatic feedback devices. They are very controversial means of implementation. These devices allow access to the location of the driver's vehicle at all times, the speed the vehicle is traveling, and acceleration speed, braking speed, seatbelt use, and passenger occupancy sensors. These devices have been proven to reduce risk of accident using teen drivers' data to help them follow rules to get the next tier of the program. Though the overall response to GDL programs has been good from law enforcement, parents, and the general public, the implementation of these devices has posed some ethical concerns for teens and parents. Teens feel that these devices are a violation between trust for them and their parents. Parents also feel that these devices can be distracting and will make teens know that they are being monitored. These devices will also take away from the interaction between teens and more experienced drivers. All 50 states currently have GDL programs. Not all states are the same, so not all states will use this device. The Journal of Accident Analysis Prevention studied the strength of GDL programs and fatalities among teen drivers and passengers of programs of different strengths. The study shows that the greatest decrease in teen driving fatalities are states with stronger programs that are implemented using people and not monitoring devices. Many GDL programs are still very weak and could use some improvements. Congress is considering a multi-year highway and transit spending bill that would give $25 million a year in incentives to states that will strengthen their GDL programs. A strong GDL program must have 7 components. Only New York and Delaware have all 7 components. The fight for 7 components draws opposition from lawmakers and the National Youth Rights Association. The first component is that the minimum age to get a learner's permit be 16. Lawmakers are concerned that raising a minimum age violates the loyalty and rights of teens. The president of the Youth Rights Association states that it is discriminatory on its face, referring to the GDL program and rights to teenagers. Studies show that if all 50 states had stronger GDL programs, there would be an estimated 2,000 lives per year that could be saved. As lives are saved, money is also saved in all areas. The expenses that result from motor vehicle collisions could include emergency responders, firefighters, hospitals, law enforcement, injury, disability, death, burial expenses, property damages, and insurance costs. There's no overwhelming evidence that these programs save lives and money. Safe driver campaigns and reward programs need to increase. Individual states created license programs that are a stronger strength for GDL will increase funding and incentives given to these drivers. Graduated driver's licensing programs have been very successful because they give new drivers the chance to improve on their skills over time in a lower risk environment. It is achieved by the new driver passing each level of their driver's license safety under their restrictions by getting instruction from experienced drivers. Many driving programs have reward systems in place for safe drivers and require them to drive safely, recorded to earn to the next level. The strong evidence that the GDL programs decrease fatalities in teen drivers has contributed to the success and popularity of these programs nationwide. Over time, GDL programs will affect drivers of all ages. If drivers in a community learn to drive beginning with GDL programs as a teen, young adult drivers, new adult drivers, and older drivers will all eventually be educated through these programs. This affects the total number of vehicle collisions in a state continuing to decline over time. As programs are analyzed and the rules and regulations become more stringent, the impacts of the programs will grow. Implementation, enforcement, and maintenance of GDL programs prevents major accidents involving teens. GDL programs reduce fatalities in teen drivers and passengers, and the stronger the program, the stronger the results. It is very evident that these programs are great and are decreasing fatalities nationwide.